My name is Jade, and today I have Belinda here with me, who is one of my fabulous friends and also a mother of two who holds her Bachelor of Nursing Science, Masters of Midwifery, postgraduate certificate in Perioperative Nursing, as well as her certificate 3 and 4 in fitness. She's incredibly kind and compassionate and is mentally and physically one of the strongest women I know. Welcome, Belinda.
Thank you. What an introduction. Wow. It's really fun. Thank you.
No, I'm so excited to have you here today. On the podcast, a lot of it is women getting their periods back, and then they get through that stage, and then they fall pregnant, and then a whole new set of questions come around.
Yeah.
So I'm so grateful to have you here to get some clarity on what the hell do we do?
Oh boy. That is a great question. What do we do now that we're pregnant? What do we do now that we've got a baby in our arms? It is a whirlwind of an experience having a baby, I must say. Being pregnant and having a baby, the whole journey is incredible. It's incredible what we're capable of, not only physically, but mentally, emotionally, and you just don't know what you're made of until you have children. I feel, for me personally, I thought I was a pretty strong, independent, emotionally stable person. And then I had my children and they just rocked my world in a good way, But yeah.
I will never forget some of the saving graces, which I guess is when our friendship really started to evolve, because we know each other as our husbands trained together for jiu-jitsu, and Sam, your hubby, used to coach me for Olympic lifting. And then we crossed paths at the Christmas party, started chatting when I was heavily pregnant. And then I had Casima and she wasn't sleeping and I had engorgement and I had all these crazy questions. And I just remember you saying at the Christmas party, like, oh, I've got my 2 kids and I'm a midwife. And you were just very warming and accommodating to the idea of, if you're not sure what to do, just have a chat. Let's just have a chat. So when I started having all of these questions, I found it really interesting that I didn't feel I wanted to go straight to, say, my mom or my mother-in-law or to anyone else for that matter. I just wanted someone who I knew well enough that I could trust, but wouldn't have that sort of firm hold of, you must do it this way, you must do it that way. And that's how you always presented yourself, very open-minded, and you'll find what works for you. And I just remember in some of those really rough nights of zero sleep, I'd send you a message being like, oh my God, she's not sleeping. What am I doing wrong? I can't do it. And you would just say, just love her as much as you can. You're doing a great job. Make sure she's fed. She's got a clean nappy and she's warm, cold, good temperature. And every time you just had that baseline answer, it was so comforting, because it wasn't, what are you doing wrong? What could you do better? It was just, make sure you've got these few essential things covered and it's going to be all right. Babies cry. It's okay.
Yeah.
And at the start, you think that your baby shouldn't cry. And obviously that's within reason. But for a big part of those first few days of their life, they cry. And you don't realize how much you think you're failing when it goes on for a prolonged period, and how much you second guess yourself and question. Did you find that with your babies as well?
100% I found that. And I felt like I started to withdraw from a lot of people. I felt very alone. I shouldn't say that because, I might have some friends listening, but I did have some friends that I felt wouldn't judge me and that I could trust to just let me complain. But my babies cried and my babies didn't sleep, they didn't sleep at all. And every time I would have a whinge that, I've been up 5 times, 6 times, 10 times, there would always be a solution. That there would always be someone trying to offer me a solution to my problem. And we do that as human beings, as girlfriends, mothers, sisters. We always just want to fix things and, oh, well, this worked for me. You're not doing this right. You need to do this. You need to let them cry it out. And I just became so just deflated that I felt like I couldn't really talk to anyone because I was so worried about how crappy I would feel after the conversation. So I'm going to be really honest. So, you know, I would get up with my baby in the middle of the night because they would be crying, I'd feed, and I'd be reading everything about it, like how do you stop your baby from getting up in the middle of the night? And every single time I read that, all the things that would be constant would be things like making sure your baby's fed, making sure they've got a clean nappy, making sure that they're warm or they're not too cold, not too hot. And just sometimes your children need you. They just need love, you know. And seeing my children grow up now, they're 6 and 4, they're not completely grown up, but as they have been growing up, my children just need love. They are so attached to me, and so they should be. I'm their mother. But, you know, I can't leave the room without them saying, Mum, where are you? After I said, I'm just going to the toilet, Mummy just needs some privacy. For 30 seconds, there'll be a little, you know, head poke around the door. Are you done yet, Mum? So for me, when people come to me with questions like you had, you know, what is wrong with my child? I would be like, there's nothing wrong with what you're doing. There's nothing wrong with your baby. Your baby just needs love. And for some people, like, it's not a problem until it's a problem. Have you heard that saying? So for me, sleep was a big thing. My children didn't sleep. And I've read somewhere it's not a problem until it's a problem. So although I was super frustrated that I wasn't getting the sleep that I wished I was getting, I couldn't do the cried out thing. I couldn't. I tried once, and my husband was like, just go and pick him up. What are you doing? Like, can you not hear him? He needs you. Like, we were both just so distraught. So I think for me, definitely try not to always fix things, just listening to what you have to say and just be like, it's going to be okay, because you do have to have an open mind. You really do, as a mother. What works for you won't work for me, Jade, and so on. You know, a lot of people, as a midwife, working as a midwife, a lot of the feedback that we would get from mothers and husbands and fathers would be that so many people are telling us so many different things. Like, one midwife would tell us to do this, and then we'd do it, and another midwife would say, that's completely wrong, don't do it like that. And it's not that one is right and one is wrong. It's just one worked one way and the other worked that way for the other person. I don't know if that makes any sense. Does that make sense?
Yeah, different things, different strokes for different folks.
That's it. And like both things work perfectly fine. You know what I mean? There's more than one way to skin a cat.
Yeah, I had a public health researcher on last week, and she goes through research-based evidence of the highest profile, and she gave us a breakdown of what makes it high-quality research in the journals that she goes through. And it was really interesting that of all the research that she's looked up so far when it comes to feeding methods, sleeping methods, milestone development, you know, those big blocks we tend to research like crazy while pregnant and the first few months of our kids' development. The basis of all the research comes down to you need to find what works best for your baby and do it.
Yeah, absolutely.
And all these other websites and marketing employees will come down and say, like, this is the best and this is the best and this is the best. And, you know, you might stumble across that first up and it just happens that that is best for you and your baby, and that's perfect. Or it might take you 5 different things and then you find your perfect. Or you've just got your own unique model. And it's not on the internet, but it works perfectly for you and your baby. And that's what matters. But I just found it so interesting that so the research she's got access to, which you might as well, I'm not sure because of your qualifications, it's not something that you can get from Google. Yeah, like she needs a particular password to almost like university research journals. And and I just found that incredible too, because you'd think everyone would have access to that science. Like, shouldn't we all have rights to that? Whether you can understand it or not is a whole other thing, because I probably couldn't. But yeah, that was the foundation of everything that she's gone through so far, which is you just need to find what works for you and your baby.
And I think, you know, we are in a society now where we all we all have to cope. Like, yeah, I'm coping. I'm doing great. Everything's perfect. you know, where we don't have our village like we used to have. Do you know what I mean? When,
Mm-hmm.
you know, when I'm Lebanese, so growing up in a Lebanese community, like you would have everyone in the house on any given day coming and going. There would be 30 people going through my grandma's house. And so, you know, you would see mums and babies, you know, feeding, interacting. And, you know, I think I learned so much from my younger years just by watching my aunties. And, you know, I was given the babies to look after and to hold on to and to feed and to change. And I don't think we do that so much nowadays. So that kind of learning, that community learning is lost a little bit. I don't know. Maybe that's not making any sense either, but
no, it's like the organic way of learning how to interpret what's coming towards you. Like my experience with babies was pretty much non-existent until I had Cosima. And yes, absolutely, I learned everything that I needed to in the time that I needed to. It's not like a disadvantage, but I can definitely understand if you've grown up having kids around you and then great grandparents and then aunties, and you somehow get a certain wisdom as you're growing, that once you have babies, you can kind of go, oh, I remember great grandma used to say this, and I remember, you know, auntie so-and-so used to say this, and then you can kind of get firsthand information rather than having to read Instagram and Google and all those sorts of things.
Yeah, I think social media plays a really big role in our expectations of being parents. I remember I had a friend ring me and they were really, really upset because their child was sick, and they're like, you know, they're trying to do all these tests and I don't want them to do them, and I'm really, really scared. And I said, listen, you are your baby's parent. You know them better than anyone else. Why don't you ask the doctors, you know, what happens if we delay this test just a few hours just to see how he picks up? Is it detrimental? Is he going to die if we wait just a few hours? Because you know that he's a well child. You know, when they did his observations, at that point, he'd been crying, he'd been screaming. So, of course, he was going to be hot. You know, they wanted to do a lumbar puncture on him. And,
oh, wow.
Yeah, like really invasive treatment, right?
Painful, invasive.
And I said, you know him better than anyone else. You've had him at home. Just you guys. No one's come to see him. So ask the question, what will happen if we just delay a few hours? And they did, and he didn't have the lumbar puncture because he came good, he was fine. But I think we also really need to trust in our own intuition. You know, this, especially as a mother, our babies have been growing inside of us for 9 months. I know we don't know them, but we're attached to them. We do know them because they've been a part of us for so long, and then they come out and it's just like, well, here you are. You know, I haven't known what you look like, but I know you. You're mine. Sounds very airy-fairy. I am a little bit.
No, it doesn't. I'm about to start crying if you keep talking like that, Belinda. Jesus.
But, you know, it's so true. I feel like it's easy for me to say my children are 6 and 4, right? Like I've gone through those hard first baby years. But if it's one thing that I've really learned, and I really just want to stress to your listeners and to other mums and dads, like, trust in your instincts. You know best. And if it is detrimental, where it's life and death and something bad could happen, then ask the question, you know, how long do we have? Can we just wait a few hours and see? Can we wait a few days and see? Can we wait a few weeks? Because, you know, there's something to that intuition. We have it for a reason. We feel that for a reason deep in our guts. It's our biology. If that makes any sense. I don't know.
But I guess when it comes to pregnancy and labor, we have the right to question the same things. And I know something I learned before you and I sort of started talking more and developed the friendship that we've got now, is that you can actually question your midwife or your obstetrician, and if they're suggesting an intervention of some sort or they want to do a procedure, you can actually ask them, why do you want to do it? What's the benefit of doing it? What's the negative of not doing it? And it's okay to have that open conversation rather than just be sort of told we're going to do this, 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 and this, and take no sort of ownership over the conversation. Would you encourage people to ask their midwives, obstetricians, anyone who's in their care at that time, if they do have a gut feeling or if they're not sure if they want some kind of intervention or procedure done, that they should learn more about it? What is going to happen if, as you said, if you wait, if you don't do it, and get your mind sort of wrapped around the whole situation?
Absolutely, 100%. Because the last thing that your obstetrician or your midwife wants to do is, give you a negative birthing experience or labouring experience. Like, where most obstetricians and midwives are there because they absolutely love what they do. They love helping you through your labouring journey, your pregnancy journey, your delivery journey. I think that a lot of people get frightened. They don't want to offend their doctor or midwife by asking, but why? And I think it is super important. Like, if something doesn't feel right to you and you don't understand why they want to do something, then you have to ask why. Because if you have that understanding, then it won't be so traumatic when it actually gets done to you and you think, well, why did that just happen? Like, my baby's fine. They told me that my baby would deteriorate and they'd have to resus them or whatever if I didn't do this, and my baby's fine. And now you've been left scarred because you didn't have your birth go the way that you thought it was going to go. So please don't ever think that you will offend your obstetrician or your midwife by asking those questions. Like, if you're unsure of anything at all, go for it. Like, you can't shock your obstetrician or midwife. Like, they've seen just about everything. They've heard just about every question, There is nothing offensive about wanting to understand why they're doing what they're doing to you, because it's your one shot. This is your individual experience. You can't ever get that experience back. The delivery of your baby, your pregnancy, you can't get that experience back. Once it's done, it's done. So if you want it to go a certain way and it's not going that way, then you have to ask those questions. Well, why can't it go the way that I've expected it to go, the way that I've planned for it to go, or the way that I want it to go? Sorry, that was a very long answer.
No, it was a fabulous answer.
Very short answer.
No, the more you elaborate, the better. It's fantastic. I guess with that in mind, what are some good questions that you could ask your midwife or your obstetrician while you're pregnant, when in labor? Do you have, I guess, some go-to questions that you find would be helpful for women?
Yeah, so this is a really good question, because just like everyone's an individual, every pregnancy is so individual as well. I think the most important things to ask are things like during your pregnancy, like if fitness and food is important to you, then obviously ask those questions about, what can I do fitness-wise while I'm pregnant? That was a big one for me, I have to admit. I would speak extensively with my obstetrician about what sort of exercises I could do, especially because I had such big babies. I had a big diastasis, big, ab separation. So for me, that was very important. Fetal movements, I think, is really important too. Working where I work at a private hospital, a obstetric private hospital, and the amount of people that come in with decreased fetal movements and don't really think anything of it. Like, you can't do your baby move, so you think, oh no, it'll be okay. Well, I think it's important to understand how many fetal movements you should be having, when you should be having them, how to assess whether or not there's actually something wrong with your baby, or they're just having a bit of a sleep, and what sort of things you can do to get them to move. Like, have a big drink of water, have a lie down, have something sugary to eat. To be honest, that's a really tricky question, because it's very, very individualised. What's really important to you is very different to what's really important to me. Well, maybe not you and I.
We're pretty similar.
But
that's probably the start. Maybe, like, let's say you've got your birth plan together, or you've got a vision about how you kind of think your pregnancy is going to follow through and how you think labor is going to happen, and to maybe break that down. It's like, well, if I should be feeling this way, what do I need to do? And if I'm currently feeling a way that I didn't think I would, like I'm nauseous or I'm really sick or I can't train like I thought I could, like break that down.
Yeah, I think there's no question that's off limits. There's no topic that's off limits as well. So please don't ever feel embarrassed to ask. You know, sometimes you think, oh God, would she think I'm an idiot if I ask this question? No, absolutely not. You know, you're not expected to know the stuff that your obstetrician or your midwife knows. So I think if you feel comfortable enough with your midwife or your obstetrician, just if you have something in your mind that you want to ask, that you want to know more about, then ask those questions. Don't feel ashamed. Don't feel embarrassed. And a thing that really worked well for a lot of my women, my pregnant women, is I tell them to get a notepad, have it in your bag, because you'll have these random questions in the middle of the night or going off and doing your shopping, and then you'll forget to ask them when you're at your appointment. So have a list. Write down the things that come to your mind when you're not with them, because 9 times out of 10, you get to your appointment and you completely forget everything that you wanted to ask. And you walk out of there going, I had 15 questions and I totally forgot to ask them. But we do focus. This is one thing that I did want to talk about, I think, for me is, my experience. We focus a lot on pregnancy. We focus a lot on the delivery. And then not so much on after we have the baby, like what happens in that first week. So I think it's really important having to think about questions around that, like how much will my baby sleep? Will my baby sleep? When is my milk expected to come in, and how long will that take? And, it takes some women, 2 days. It takes some women 5 days to 2 weeks. It just depends on your labour, depends on the type of birth you've had, it depends on the blood loss you've had. So I think also doing a little bit of research about postpartum, because there's a lot of stuff that gets missed and you get really surprised by. I was very surprised in the postpartum phase. I don't know about you, but it just felt like I concentrated so much on pregnancy and labour, I forgot about all the stuff that I was meant to know as a mother afterwards.
Absolutely. Absolutely. And look, I was actually really grateful that one, I had a Caesar because everything worked out perfectly and Kasima was healthy and, the outcome was just beyond perfect. But it meant that I was in hospital for 4 or 5 days. So when I had a question, there was always a nurse there to just reassure me, comfort me, give me an answer. And I guarantee you, every time a nurse walked in and I was breastfeeding, it was, are they latched properly? Are they okay? Like, is the milk coming? And they would just like have a check and yeah, everything's okay. Da, 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 da. And I was so grateful, and especially more so months later when I could reflect on the guidance I had those first 4 days, because so many women go home after 24 hours. And don't get me wrong, if and when I have my second, if I was home in 24 hours, I think I'd feel a lot differently because I know what it's like to breastfeed. I know what to expect from my newborn. And I'm sure newborn life again, second time around would be so, so different. But my baby was just like your babies in the way that she'd rather be awake than asleep. And those certain things, the most common comments you get from people is like the newborn stage is the easiest because they sleep so much. So that was my expectation, newborn sleep. So that kind of rocked me a little bit. And whenever I heard about breastfeeding, it was always milk not coming in. So all I really researched was how can I boost my supply? But then I had engorgement and I'm like, what do you mean engorgement? Like, what is this? And that's when you come to my saving graces, because you're like, oh, the magic of breast pumps. Just pump before you feed her. She'll latch much better. And oh my God, wasn't that a massive help? Because the engorgement didn't kick in till, it wasn't too bad in hospital. It was so much worse once I got home. And by then I didn't have the nurses there. And thank goodness I had you there, because no one else in my circle breastfed. So they didn't know. And if they did breastfeed, they didn't have engorgement. So it was like, I don't know. I would love to help you, but I'm just not sure. And just what you were saying about asking about those first few weeks at home, I never would have thought to ask those things because I didn't know they could happen or they would happen.
I think, sorry to interrupt you, but I think especially from what I would see when I was learning to be a midwife, there would be questions around breastfeeding, and the midwives would be like, oh, breastfeeding's natural, it'll be fine, you'll be fine, don't worry about it. You want to breastfeed, you can breastfeed, it'll be fine. You know, you worry about that after you've had the baby. And I don't want to deter breastfeeding from any of your listeners, but to be absolutely honest with you, breastfeeding is one of the most difficult things that I have ever done. My son and my daughter have tongue and lip ties, and my experience between the two, breastfeeding the two, were very different. Jackson just sucked and sucked and sucked all day long to the point where I thought my nipples were going to fall off. I'm sorry for the too much information.
It is what it is.
It was so hectic. I did not expect that. Like, I thought, I'm a midwife, I know what to do. But like you, I had a cesarean. I had laboured all the night before, all that day. Finally had my cesarean section, had a baby in my hands, and now breastfeed. Was exhausted. So, of course, I had him on my breast and I would fall asleep. I don't know about you, but the first couple of days of breastfeeding, every time I would start to breastfeed, I would start to fall asleep. I was just exhausted. I don't know what it was. So I had lots of grazing on my nipples, which brought me a lot of shame because, like, I'm a midwife, I should know how to breastfeed my child. But it just kept slipping off because I kept falling asleep. And like you, I got the engorgement to the point where I would pull down my shirt and it would just spray. Like, there would just
everywhere.
be everywhere. And like, the poor dude couldn't get on because
it'd spray him in the face and then they get upset. It's horrible. Exactly. It's actually horrible because obviously it's not intentional. You don't mean to do it. And then you just got this super cute, relaxed, chilled out baby who you know is hungry, and you spray them in the face and they are distraught about it. And it sounds funny and I can laugh about it now. Yeah. But at the time I was like, oh my God, I can't even just like pause the milk for a second to, yeah.
It was so hectic. So, and then Frankie,
and that also influences your confidence to breastfeed if people are around, because so many people, if and when we did have visitors, because it was, you know, COVID lockdown time, I'd say to John, like, if I've got to go upstairs to feed her, and he was completely fine with it, but the person who was visiting might go, oh, look, I honestly don't mind, it's fine. And I just have to sort of go, oh no, look, it's okay. And for the most part, it was because you see in cafes, some women have got it perfectly down pat and they've got their little shawl that covers their boob and the baby's under there and there's no mess and it's quite graceful and they're sipping their coffee. And I thought that'll be me. If I breastfeed, because it could be formula, I don't know. But if I breastfeed, that's what it's like. And then, yeah, no, it was far from that. And it can actually create some anxiety because you're already really, really tired. And then you've got all these other things to think about. And that literally could just be containing the milk until bub jumps on. Yeah. And again, things that you wouldn't think of until you're there.
Yeah, and that's what you don't think about. You hear all the time that breastfeeding is really natural and you and your baby will know what to do and you'll be fine. Well, look,
you learn as you go.
And it is really great. And your baby kind of does know what to do, but it is a little bit tricky at first. You have to get to know your baby. Your baby has to get to know you. And it's a partnership. You guys will get there in the end, but it can be difficult at first. And I think, you know, talking to your midwife about breastfeeding is also really important in the prenatal, perinatal phase. And even doing a little bit of research about it. You know, maybe breastfeeding's not for you. There are drugs that you can take to dry up your milk once your baby's born. So you don't have to worry about your milk coming in or there being any leaking or anything like that. You can just put your baby straight onto the bottle if you'd like.
I always wondered that.
Yeah, there's a
because I always thought, I've always thought, how do women not, like, if they choose to not breastfeed or whatever happens and they just don't breastfeed, how do they not get mastitis, especially if the milk comes in? Is that what they do?
So they can give you a drug, and it's really helpful too for women who have, delivered babies, stillborn babies and things like that. So
of course. No.
But in those instances as well, that can be really helpful. So it's good to know your options about breastfeeding and not just to accept that it's natural And if you really want to do it, you can do it. Because from experience as a midwife who's breastfed 2 children, both of my children, I had very different breastfeeding experiences. And both experiences, at first, I did not find them easy. It was hard. It was hard work.
I cut you off about Frankie. Do you want to talk about your breastfeeding experience with Frankie?
Frank's my darling girl. So she had tongue and lip ties as well. And if you get on the internet or if you talk to any pediatric expert, it's a first world problem, right? You don't see babies in third world, or you don't see women in third world countries complaining about tongue and lip ties. Well, that's because they're in a third world country. We're not in a third world country here. So Frankie both of them had tongue and lip ties, and it's when there's excess or overgrowth of the skin that attaches the lip and the tongue. So you can have upper, lower, you can even have cheek ties if it's that severe. And basically what it does is it hinders the ability for the baby to latch and secure a suction around the breast. So they can't latch properly. So in some instances, they just don't get enough milk. Some instances they can get enough milk, but breastfeeding is incredibly painful. That was Jackson. He had tongue and lip ties, great suction, no problem, but I had quite a lot of pain. Frankie, she couldn't get a secure suck, so she would gulp a lot of air, which meant that she would projectile vomit every single time I fed her. Now, I'm not talking just like a little posset, a little spit here and there, like it was a projectile vomit, to the point where I went through cupboards daily full of towels. Like I would be washing towels every day. There'd be vomit splatters all over the floor. And at 6 weeks, and for 2 weeks, I wondered why my child was vomiting so much and why she wasn't gaining weight, because I had milk. I had so much milk, like Jackson. And then it wasn't until I thought, I haven't looked in her mouth. Maybe she's got tongue and lip ties. And I had a look, and fair enough, there was a tongue and lip tie, which kind of disappointed me a little bit because I had a pediatrician check her. And she knew that there were tongue and lip ties when I went to my 6 weeks checkup, but she hadn't told me at birth.
Really?
So, and it's like this first world problem, right? Like they don't have these problems in third world countries. It's just something, it's like a pseudoscience here apparently. But let me tell you, I got her tongue and lip ties lasered at 6 weeks and it dramatically improved. She was still having some issues with a bit of vomiting here and there, but it was a lot better than what it had been. There was no more projectile vomiting. She at least settled. She would just feed on my breast for 23 out of the 24 hours a day because she was vomiting so much. So she wasn't having a full stomach, so she wasn't sleeping well. It was really hard. I sound like such a whinger saying that breastfeeding is really hard, because I know that there are some women that really don't have any milk and they really can't breastfeed. But from my experience, it was exhausting.
But different women will have different experiences, and it's okay to acknowledge that sometimes breastfeeding is traumatic, whether your milk's coming or not. And it's okay if you couldn't breastfeed and you're sad about that. And it's okay if you could breastfeed and you've still got sadness around it. And you've probably experienced this conversation more than anyone I know. And that's it. Breastfeeding tends to be such a tricky topic to navigate because people's emotions and views around it tend to be really sensitive. I was quite open-minded to fed is best. And that comforted me. It's like, I'm going to try breastfeeding, and if it works, it works. If it doesn't, it doesn't. And I felt long-term that put me in a much better position because I didn't have an expectation. But, there is a lot of women out there who, even before they've delivered their baby, they've got all this research at hand and it's like, breast is best, breast is best. And then for whatever reason, things work out different. And it could even be there's been a complication with baby, they're in the NICU ward and you've got to express, or they've got to have formula top-ups because your milk hasn't, there's actually so many reasons that you don't realize until you've actually had a baby or you've spoken to other mothers that might interfere with your ability to breastfeed. That's actually got nothing to do with your milk production.
Yeah, that's right. I've known so many women, their children have had tongue and lip ties, never been diagnosed, and haven't been able to breastfeed. And it's not until they've had subsequent babies that they've realised, hey, hang on, this is a real thing. And they've been straight onto it, had them assess the tongue and lip ties, had them lasered or snipped or whatever, and have had really successful breastfeeding journeys after that. One of my good friends has had 3 children. Her first child, she couldn't breastfeed past 6 weeks because she had severe tongue, lip and cheek ties, and she didn't realise until like further on into the baby's life, had them lasered. But that also affects their speech as they're older. So if you don't get those tongue and lip ties checked and treated, it can impede their speech as they get older, and it can impede their eating, because if the food, they can't use their mouth correctly, they can't chew their food correctly. So they'll obviously avoid things like steak, and you're feeding your baby steak, but as they get older.
When they get there.
Yeah, that's right. They can't eat that food. So my nephew, he was 3 when he had his tongue and lip ties done. They had it lasered, and he had to have an anaesthetic for that because he was obviously too old.
And aware.
Exactly. Because they had to lie very still to have that done. And he wasn't speaking. He hadn't been speaking. Like, they're meant to say certain words, and so many words at the age of 2. And I mentioned to my brother, why don't you just get him assessed? Like, it could be a number of things. It could be his hearing, but it could also be his tongue and his lip ties. So just, if he's got any, have a look in his mouth, go to a professional, go to a dentist that's certified in doing laser treatment for them. And he did, and it was the tongue and lip ties that were impeding his speech. So I guess it's not, I don't feel like it is pseudoscience. And in my gut, I knew that there was something wrong with Frankie and her feeding. And, it's one of those things, as I mentioned before, like, trust your instincts, like all the pediatricians were telling me that it's pseudoscience and it's rubbish. Well, there are all these instances that I can think of where it's not. Like the tongue and lip ties really did influence feeding, speech, breastfeeding. So yeah, what's the harm in getting it checked anyway? Well, I don't even know what we're talking about then. Breastfeeding. Sorry.
No, because it's no, because Cosima had a tongue tie, and I think that's where it's good to just analyze that gut instinct is so important, because they noticed she had a tongue tie and they were very concerned about it every time she come in. And I might have even spoken to you about it once I got home, because John and I just decided that we didn't want to do anything too quickly because we don't know a whole lot about it. And she's a brand new baby. We really don't want to snip anything that we don't have to. And at the time they said to us, implications of tongue ties, cheek ties is they're not going to feed properly. It could affect their speech, and essentially they can't poke out their tongue properly. And John and I decided that at the moment she's making all the sounds that she needs to as a newborn, and she was feeding really well. We didn't have the projectile vomiting or anything like that. And we decided we'll wait a little bit longer. Yeah. We're not seeing any negative effects, and let's just wait and see. And then I think I saw my midwife a few days later, and she said, yeah, look, if that's what your gut's telling you and she's feeding well, just go with that, and just be mindful that the tongue tie is there in case things start to change. That could be what's causing it. And she said, but when she's a little bit older, if you can, just keep trying to poke your tongue out to encourage her to poke it out, because for the really mild ones, they can just stretch the skin. And touch wood, that was the outcome for us. She fed just fine, and she pokes her tongue out just fine now. And but there was the potential there to sort of freak out and react and snip the tie. And you know what, it wouldn't have hurt her if we did get it snipped. Like, there was no actual negative outcome regardless of the choice, but just what you were saying about the gut feeling. And it's like, I just felt like it was going to be okay. Like, there wasn't, and I had no merit behind it. So far everything's worked out that way. We didn't get Jackson's done because there were no issues. Like, he's had no issues with eating, speech, but at the time Frankie, she needed and that's probably a good thing to address, just what you said about the vomiting too. Like, we know newborns puke, like they do, and they do it a lot. But if they're projectile vomiting, doesn't necessarily have to be a tongue tie or a lip tie, but that's not normal newborn behavior.
There was something not right. And and then I felt like a failure because I was like, what am I doing wrong? I've already had a child. I've already breastfed. Why isn't this working like it did before? I thought it'd be a real walk in the park. But it's just different. It was different, and it will be different when you have more than one child.
Yeah, it's funny though, because I even think now, come second time around, I would have a more relaxed attitude, just because I feel like I've learned a few things that I didn't know before the second one. But then the other 50% of me is like, yeah, this is a whole new human. You've got no idea what that little human's going to bring to the table.
No, you're right. They do throw you, the second ones do throw you a bit of a curveball. But I think you have more faith in yourself, you need to trust your instincts more with your second, because that's what got you through with your first. It's
like you've had the practice that trusting your intuition pays off, where at the start it's like, do I trust it? Do I not trust it?
Yeah, well, this is my first baby. Like, I'm not supposed to know anything. I don't know anything. So I'll trust everyone else around me. Well, you can do that, but also be guided by your gut. I think that's really important too.
Can I ask you, I guess, a little bit more on the practical side of things when it comes to delivery? There's quite a few intervention methods these days, stretch and sweeps and inductions, and obviously cesareans and episiotomies. And are they called tongs these days?
Tongs.
Are they tongs? Will they clip the baby and pull them out?
Oh, like there's suction.
There's the suction. Maybe they don't use them anymore, but they like.
Oh, yeah, we do a forceps delivery.
Forceps, thank you. Tongs. Yeah, very well versed I am.
They look like big tongs. They really do. So what do you want to know specifically? Like, what sort of things do you want to talk about?
Maybe could you walk us through what an induction is and why it's used, and then we might break down some of the other ones.
Yeah, sure. Okay, so there's a few different ways to induce labour and a few different reasons why your obstetrician will be wanting to induce your labour. So the obvious one is you've gone post-due 40 weeks and 10 days. We don't know really why we go to 40 weeks. Like, if the baby's cooked at 40 weeks, it has to come out. And if we leave it in any longer, then there will be, dire consequences for you and your baby. So depending on your readiness to deliver your baby, so depending on the cervix, you can have the gel put in to ripen the cervix to help bring in labour. If your baby is quite low down, you can have, a rupture of membranes. The reason that they don't like to rupture the membranes if your baby is still quite high is because you can have a cord prolapse. So, they want to make sure that the baby's head is well low, so that, there's something in between the cervix and the baby's head. And they would really only do a rupture of membrane if you were, dilated somewhat, but you hadn't been contracting or going into labour for whatever reason. Or if you are in labour but you don't have very good contractions or consistent contractions, I guess, they can put up the oxytocin drip, which
the feel good drip
isn't really comfortable. It can bring on labour pretty hard and fast, or it can bring on contractions pretty hard and fast. So yeah, they're the most kind of common ways to induce you. Just a disclaimer, I haven't been on a labour ward for a few years now, so there could be lots of other different ways that they induce your labour as well, or different methods and reasons for inducing labour, but they're just the ones that I was used to when I was working in the labour ward. Really important though that you know why you're getting induced. It's really important to know what the side effects of being induced can be, and just really asking why. Like, you are in charge of your body and your baby, so have that full discussion with your obstetrician. And if something isn't making sense, then get them to elaborate. Like, if you're not understanding, get them to explain it more to you. I think that's really important. I think depending on where you are, if you're in the public or the private sector, probably much the same. They just want the baby out as quickly and as safely as possible. And that may not align with the way you want to deliver your baby, the way that you want to labour, at least.
That's probably a really important thing to touch on, though. It's like it's one thing to have a birth plan that kind of makes you feel empowered and excited and happy and, you know, all the fun parts of being pregnant, but it's also a really good thing to be well prepared that sometimes things don't go to plan, and that's okay. And how are you going to process it if things do go off track? And are you going to be okay if you're presented with some intervention method? How are you going to process it? What kind of questions are you going to ask? Because sometimes it's easy to go, no, it's just going to be perfect. I don't need questions. And it's like, you always need questions. Always.
Absolutely. Especially this having some idea about a Caesar and what the Caesar involves and why they would do a Caesar. You know, a lot of women don't want to have a Caesar. And that's absolutely fine and fair. You know, you just want to try and have a vaginal delivery. Absolutely. That was me with my first pregnancy. I was going to do anything it took to not have an epidural and to have a vaginal delivery. Little did I know that my baby was 4 kilos and I just don't have a wide enough pelvis. So he wasn't going to come out like that. And, you know, I kept saying to my obstetrician, really, really want to try for vaginal birth, really don't want an epidural. And when it got to the point where I was 2 centimetres dilated and I'd been in horrible labour, like I was having contractions every minute for 2 hours, and my cervix dilated to 2 centimetres, like it had done nothing. So I changed my mind. Give me an epidural. I had the epidural, and then Jackson started to have late decelerations. So late decels are where his heart rate drops after the contraction. So he wasn't happy. And I had heard them on the monitor. But I know that my obstetrician, he knew that I wanted a vaginal delivery. So he was just waiting to see how it was all going, you know. But I feel like after my epidural, I kind of went somewhere else. Like, I don't know if I drifted off to sleep or I just relaxed for a little bit. And then I kind of came to when I heard the late decels, because, you know, I had the monitoring on me and I could hear his heartbeat. And I heard his heartbeat drop, and I remember looking at the midwife and I remember saying, is that a late decel? And she said, yeah, you've had a few of them. What are we doing? Why are we
waiting?
Why? Where's Wei Ching? Does he know? And she said, where's my obstetrician? Sorry. Where's my obstetrician? Does he know? And she was like, yeah, he's aware. And I said, is he here? Can I talk to him? So she brought him back, and I said, you know, there's been some heart rate drops. And he's like, yeah, we're keeping an eye on it, and then, you know, we'll give you some oxytocin because we'll give you the drip because your contractions have died off with the epidural. And I looked at him and I said, just call the Caesar. I've had these heartbeat drops. Would you normally call a Caesar? And he's like, look, I think you might have to have one. We can see how it goes. And I said, I know I really want a vaginal birth, but do you think it's going to happen? And he's like, Belinda, most likely not. And I said, call a Caesar. Let's do it. Get him out, you know. And I had him, and he had the cord wrapped around his neck twice. So with all the contractions, the cord had been pressed, so it was decreasing the blood supply to him. So he was having, you know, these big drops in his heartbeat. The kind of take home from that is that my obstetrician really knew that I really wanted to have vaginal birth. That's all I talked about. That's all I'd wanted. But then in that moment, something was wrong with him, you know. And I was the one that was like, let's do a Caesar, let's get him out of me, because I was also aware that I didn't want to have a Caesar at midnight if we kept waiting, because that's what would have happened. We would have waited a few more hours, or there could have been something really wrong with him. We'd waited too long. So I think I've got a really good understanding of a Caesar. I'm a periop nurse. I do lots of Caesars every week, so I know what they are about. I know what's involved in them. I know why we do them. I know about the recovery of them. So I think it's just like, it's important to know that Caesars aren't scary. They're there for a reason. And in my instance, they saved my little boy's life, you know. I wouldn't have been able to deliver him vaginally. And yeah, just have a think about all the things that, well, have a think about other options during your labour. Like, it might not go to plan. You might not be able to have vaginal birth. What's another alternative if you can't have vaginal birth? What happens if you have to have an emergency Caesar? What is that about? And, you know, have to talk to your midwife or your obstetrician about the Caesar and the process, the pros, the cons. Yeah, for me, I already knew I was really lucky. But I think that's something that you should consider as well. Like, it's having a Caesar. I feel like there's two trains of thought. There's like the Caesar is the devil. You need to just have a vaginal birth, or have to have a Caesar, because why would you have a vaginal birth? You know,
Yeah.
kind of,
yeah, there's two different schools of thought on it.
Yeah, but I was very open-minded to anything. I feel like I was very open-minded to having a Caesar, because I kind of knew in the back of my mind that I would need one. I was so heavily pregnant. I was so big with Jackson. When I say he was 4 kilos, he's like almost 9 pounds.
Which is a big baby. And how tall are you?
I am 159 centimeters, so 5'2". You know, I was pretty short. I am pretty short, and I was pretty small, and he was a big baby. So although I really desperately wanted to have vaginal birth, I always knew in the back of my mind that it just wasn't going to happen. And just to have that open mind, you know, be open to things not going to plan. That was my big thing. Anything can happen.
Yeah, I feel like there's two takeaways from that story too. Which one? Thank you for sharing it. But also, if you hadn't had the knowledge that you had about the heart rate and stress to the baby, your obstetrician was making his decisions based on your desires, potentially before how stressed out the baby was, because obviously he's trying to make you really happy with your birth and not experience any trauma.
Yeah.
But a question I'd never actually thought about, even until you just brought that up then, is, well, what happens if we wait this out? And you didn't know there was the 2 loops around Jackson's neck.
Yeah.
So time plays such a big part. Yeah. Your obstetrician or your midwife's desire to fulfill your perfect birth plays a big part. Yeah. And honestly, they're 2 elements I never once thought of until you've just brought it up, but actually play such a big part on how everything plays out. Because let's say you didn't have that knowledge and your obstetrician was like, all right, let's just try one more induction method, see if we can speed things up and move things along. But the outcome could have been so different. And that could have been like, you still had a cesarean anyway. And it was just, you went through the stress of labor for a lot longer than you needed to. And Jackson was still happy and perfect. And, you know, it was still a great outcome. But did you really need to go through more hours of labor only to have an outcome that was kind of likely to be that way anyway? No, thank you for sharing that. There's a lot of takeaways from that experience. And now I know you deliver so many babies, or help deliver so many babies through cesarean, because one morning we were meant to train together and you're like, oh, I got called in delivering babies. And I was like, God, it's amazing. I wish I could say that I couldn't show up somewhere because I was delivering a baby. Could you actually take us through? So I guess I'll go back a little bit. When I had a Caesar, I didn't put much thought into it. It's like there's a slit, the baby comes out, and I get stitched back up. Yeah. And then I watched something that broke down the layers that get cut through in order to get the baby out. And suddenly I felt a little more like a warrior than just some lady who had a basic slit in her belly and her baby popped out. Could you maybe describe the layers that get cut through as a result to And you can go in depth as you want or as basic as you like, completely up to you. But I guess for women to get their head wrapped around, and this is not to scare anybody off, Belinda and I both had very good experience with cesareans and are training now, and, you know, like very happy with the outcomes, but just more to recognize, you know, like I jumped into exercise way earlier than I should have because I didn't understand how deep the incision is and how much muscle and tissue gets cut through to have a cesarean. So it's more just on the education front, and perhaps for women to put the brakes on a little bit come time to return to exercise, because you know what, the body does go through a lot of trauma through that surgery.
Yeah. So when you have a cesarean, it is major abdominal surgery. You are cutting through all of the layers of the abdomen to get to the uterus. So when I was doing my postgraduate studies, one of the questions were, how many layers of the abdomen are there? And there's like 12 different layers, like ridiculous. Now, I don't remember all of the names of those layers, but there are quite a few. And I sometimes feel like, you know, people have this stigma around having a Caesar, like it's the easy way out. Well, let me tell you, my friend, it is not that easy, because as you say, you are cutting through all of those layers of your tummy to get to your baby. Like, it still has such a big impact on your body and your recovery. Now, in saying that, even though you have had this major abdominal surgery, you cannot believe how quickly and well you can recover from one. Like, I was really shocked at how little pain I actually had after having the Caesar. Now, I think part of that was calling the Caesar earlier with my first child. That played such a big role in that, because if I had just let my body continue to labour and labour and labour, then I don't think I would have recovered as well or as quickly as I did. I had a booked Caesar with Frankie the second time around, and the recovery was even quicker, you know, because I hadn't gone.
Really? I always wondered that, because it's like you're going through the same incision twice. Is there scar tissue? Is there all these sorts of things? But no, that's really interesting.
But 100% I recovered even quicker. There was even less pain because my body hadn't been through the rigors of labour. You know, like, I'd had a good sleep. I made sure I had drank, 3 litres of water the day before, so I was well hydrated, all that stuff. So with your abdomen, you obviously have, I'll break it down so that it's not 12 layers, because that's just too much, but you've got the skin, then you've got, the subcutaneous, the fat layer, you've got the rectus sheath, so you've got a little sheath that covers your muscles, okay? So you don't just have kind of muscles that work there encapsulated in what we call a sheath, and they keep all the muscles nicely encased, because if they weren't in this sheath, then you would have like muscles and guts protruding through, okay? So there's the sheath that they cut through, and then you have your muscle layer that they go through. Then what they do, because your uterus and your bladder kind of sit very closely to one another, they dissect down the bladder to make sure that it's well out of the way. So there's some connective tissue that kind of connects the uterus and the bladder to each other. So they dissect that down, make sure that's well away to protect your bladder. They put like a little, what's it called? My mind's gone completely blank now. A little retractor in the waves to make sure that the retractor keeps the bladder well and clear of the uterus. And then they cut through the uterus, they cut through the sac that's encapsulating your baby, and they either can bring the baby out nice and easily with their hand and a little bit of pressure on your tummy, or they have to put in the forceps to help guide the baby's head out of your abdomen. So that's quite a lot of layers that they have to get through to get your baby out. Depending on your previous surgeries will also depend on how easy it is to get through those layers. So you may have some scar tissue, you may have some adhesions where different organs have adhesed to other organs. So like the bladder can be a little bit difficult to dissect away from the uterus. But that's why you have these obstetricians that have studied for tens of years and have all of the knowledge and expertise that they have in doing these operations. Like, they don't just let anyone go in and do a Caesar, right? Like, these are trained professionals. So things can go wrong when you have a Caesar, just like things can go wrong when you have vaginal birth. You can bleed just as much as you can bleed having a vaginal birth. So, you know, PPH is still a risk factor in having a Caesar. You can, excuse me, you can get an infection from having a cesarean section for, you know, many reasons. Sorry, my husband just walked into the garage. Hello.
Hi.
But yeah, your body does go through quite a lot when you're having a cesarean section. But then in saying that, you put together really well, right? Because we don't want guts and stuff falling out of people at home. So lots and lots of sutures go into putting your uterus back together. What they generally do is they put 2 layers of sutures through into your uterus, because just say you want to have another baby, you need to make sure that the uterus is going to be strong enough to withstand another pregnancy. So they put in 2 layers into the uterus. They make sure that the uterus is clear of the placenta, so they make sure that the placenta is completely out, which is one good thing about a Caesar. You know, you can make sure that it's completely clear of any membranes or placenta. Then they'll sew back that rectus sheath, because if you don't sew back the rectus sheath, what can happen is you can create a hernia. So they make sure that that's sewn back really well. Then they sew back your fat layer, okay? And then they sew back the skin together and hopefully give you a nice scar. You know, I hear a lot of the obstetricians saying that the success of the Caesar is measured by how good the scar turns out. So most people are more worried about their Caesar scar than anything else. And there's so much more that goes into just that scar, like, you know, getting all those layers sewn back together, making sure that there's hemostasis, that you're not bleeding too much. There's a lot that goes into it, but it's life-saving. And, you know, I've got 2 beautiful babies thanks to a cesarean section. And just like that, you know, just with the recovery after a Caesar, and even after having a vaginal birth, like, give yourself some time to recover. Like, you know, you haven't just gone and cleaned the house or, you know, entertained for a dinner party. Like, your body has gone through so many changes by growing a baby and then delivering a baby, whichever way, Caesar or vaginal birth, and then to, you know, stopping the bleeding. You know, the uterus has to contract and all these different hormonal changes take hold, and fluid shift in your body after getting rid of, you know, the baby, the placenta, all of the amniotic fluid. Just postpartum, you don't have to race back out there and be Wonder Woman. Give your body that time to just heal and relax. And I'm so guilty of this. You know, I was like, right, it's been a week. I'm going for a walk around the block. I need to move. I need to move now. And I didn't do any harm in doing that because I was very careful. It was just a walk around the block. But I know that a lot of ladies do rush back into exercise and do inappropriate exercises because they want to look a certain way or feel a certain way. For me, exercise isn't just about how I look at the end of it. It's about how I feel. Like, it is a real stress relief for me. Mm-hmm. If I don't exercise, I don't like the person that I am. I'm not a nice person. I'm so stressed and anxious, and it really levels me out. So pulling back the reins when it came to exercising after I had my children was a really, really big mental game for me. It was really hard. Choosing my exercises appropriately after having a baby was probably the most important thing in my recovery. I was a weightlifter before I had my children. I did Olympic weightlifting as a sport and I competed in it.
To give people, I guess, a bit of background, because a lot of our listeners are training and are well aware of weights and different movements, can we whip out some max lift numbers so people have got an idea of some of your strong lifts.
Okay, so look, if you put it into perspective when you're looking at the Olympics, so it wasn't amazing.
Or any because I look at your training and even how you train now, and I can never see myself squatting the kind of weight you squat. Like it's quite incredible. So we're not talking someone who leisurely goes to the gym. You are quite intense when it comes to your strength training. So when you wanted to return to full capacity, you know, your timeline was a lot longer than someone who kind of trains more for fun and for health, because you naturally push a lot more weight than, you know, a stock standard person.
So for me, when I was Olympic weightlifting, I think my max back squat was 115 kilos. My front squat was 100 kilos. I could snatch 65 and I could clean and jerk. I think 85 was my best clean and jerk. And that was at 58 kilos body weight. So quite little.
Yeah, so you were squatting nearly double your weight. Yeah. Just because people understand, because obviously training capacities are so different amongst different people. And if you're returning to exercise and your exercise of choice is, say, Pilates or yoga focused or high rep, low weight, your timeline back to training is going to be so different to someone who's returning back to your volume and, you know, heavy lifting. So I just wanted to set a bit of context, but no, keep going, because you also had ab separation as well.
Yeah.
So you had to take it really slow.
A big diastasis. So going into pregnancy, I was of the mindset that I'm just going to continue kind of doing what I'm doing. Obviously, I'm not pushing for max weight anymore. It's more about just moving the weight around, keeping my technique tight, and just moving. You know, being around my teammates was really important for me too, because that was part of my mental health. And post-operatively as well, getting back into Olympic weightlifting was a long journey. I obviously waited for 6 weeks before I did any kind of structured training. I did I would walk, and I had this really horrific machine called an Airdyne bike. Mm-hmm. And so I would just get on there and like cruise my legs around for 20 minutes. And to give listeners context, you know, I would be used to training 6 days a week, 1.5 to 2 hours a day, sometimes double sessions. So I was very used to exercise, probably like your listeners, so probably like exercising as well. But, you know, my body was very well accustomed to all of the exercise that I had been doing during my pregnancy as well as postpartum. But at that 6-week mark, I went and saw my obstetrician. I went and saw my physiotherapist, because I had worked very closely with my physio as well because of the diastasis. I had, I think, about a 3-finger gap in my ab separation. So for me, that was the priority, to get my abs to come back together and not to hinder that in any way, shape or form. Because, you know, as well as doing obstetrics in the operating theatre, I'm also a plastics nurse. So I do lots of plastic surgery, and bringing back those abdominal muscles is one of the operations that we do in plastic surgery, you know, abdominoplasty, you've probably heard of it. So, you know, you kind of cut away the lower part of the flat part of the apron of the abdomen. But what we also do is we sew up that rectus sheath, that abdominal sheath, to help bring the abdominal muscles back together and give it some strength again. Because if you've had a diastasis, if you've had an ab separation, you never really have that strength that you used to have. So not only do you have like a gaping belly sometimes, because, you know, your belly's kind of pushing forward, but you also get a lot of back issues. You know, you get really sore back because you don't have the strength in your abdominals to help hold your body in a position that it's meant to be in. You know, it doesn't give it the support. So for me, getting the diastasis back to where it should be, or getting it rectified, is really important. So I had a list of little exercises that I was supposed to do, and exercises that I was absolutely to avoid postpartum. And even during my pregnancy, when I had the diastasis, there were exercises that I absolutely had to avoid. And basically that being just anything that increased my intra-abdominal pressure was to be avoided. Anything that I needed lots of abs to stabilize my body was a big no-no. So
yeah, so we're talking crunches, plank holds, hanging, because hanging, if people don't know, actually activates your core a whole lot.
Yeah. Standing presses, because the vast majority of my Olympic lifts are standing overhead, the snatch standing overhead, clean and jerk standing overhead. So when I came back into training, I was very mindful of if I did anything overhead, it was super light and it was always seated. I did lots of core activation drills and lots of pelvic floor drills. Even though I didn't have a vaginal birth, it was still really important that, your pelvic floor and your core are kind of one. You can't just do one without the other. So I was very mindful of working my deep core muscles, switching on my deep core muscles, and also working in my pelvic floors. And that was just part of my warm-up routine. So, you can't find time to do my pelvic floors, or let's forget to do my pelvic floor exercises. No, that's part of your warm-up routine. And even when I've trained clients postpartum, whether it be, I've trained people as early as 6 weeks postpartum to, clients who have 8-month-olds, that this is the sequence that we're doing. These are the activation drills that we're doing. This is all part of your warm-up so that it doesn't get missed. Right.
And for the most part, they are short movement patterns as well.
Yeah.
It's not like another training routine where you've got to spend an hour doing it. It can be 5 to 10 minutes and it's very efficient, but a big part of it, and I guess that's where it really helps to see pelvic floor physio, is knowing if you're contracting properly, because so many women think they're doing pelvic floor and their intentions are there, they're perfect intentions, but they're either holding for too long or they're not completely relaxing, or they're pushing past relaxed, which obviously can cause other complications later on. Would you say that you're an advocate for seeing a pelvic floor physio either during your pregnancy or afterwards?
Oh, 100%. Go see them during your pregnancy, 100%, because having a good pelvic floor isn't just during your pregnancy or just during the birth or just after the birth. Your pelvic floor is important for the rest of your life. Now, we have trouble as we get older as women because we've had babies, whether it be we've had them vaginally or we've had Caesars. Just all that pressure on your pelvic floor, all that pressure on your abdominals will affect, you having bladder control issues as you get older. I mean, how many times have you gone to do a box jump or double under?
Oops, wait a little bit.
Oh, I can feel that, so it's doing this will set you up for the rest of your life, having really good bladder control for the rest of your life. So 100%, I didn't go and see a specific pelvic floor physio or pelvic, I don't know what it's called, sorry, but I just went to my general physio that I saw all throughout my sporting career. I make it sound like I'm an athlete. I'm totally not an athlete, but
no, but you've trained, like you've had very structured training for a very long time with set intention to compete.
Yeah.
So it's like we're not at Olympic level, but you don't train for you train, you do enjoy it, but you've always had short and long-term goals attached to your training.
Yeah, and there's always competition kind of mixed in with the competitiveness in there. But yeah, I went and saw my physio and he was amazing. Just giving me some simple activation drills with my core and my pelvic floor. And that stuff now that I give to my current clients, that stuff is invaluable to me and it will be invaluable to you. Really invest in it. It's super important. I can't emphasize the importance enough. It really helped me. My diastasis has come back to normal. I have great strength back in my core now. But a lot of women don't have that success because they don't do the crappy, boring stuff that no one wants to do. And that's what it is. It's boring and no one wants to do it.
But it really is a short-term sacrifice for long-term gain, because I'm sure you've experienced it with clients as well, is that if they tend to skip those exercises because either they didn't recognize the benefit behind it, or they weren't doing them properly, or it was just boring and I don't want to. And then all of a sudden it tends to be more common to women that jump or run frequently. And suddenly they're in a position where they've lost bladder control, they've had a prolapse, or they're having all these other issues. And either way, they need to go back to those basics again, because, hey, if you want to improve on these conditions, we need you to be able to activate your pelvic floor. We need you to know how to activate it, when to activate it, and when to relax it. Like, it goes both ways. You need to know both.
Yeah.
And sometimes skipping the cue of doing those movements because you just want to race to, your favorite kinds of movement, sometimes results in you going back to the boring stuff for twice and 3 times as long, because you've accidentally done damage that now you've got no choice but to do those basics again.
Yeah, absolutely. And I think we do want to go back to normal really quickly after having a baby. Like, I wanted to just go back and do all the stuff that I was doing beforehand. But you not only need to consider you've just had a vaginal birth or a cesarean, but you also have fatigue on top of that, because you're producing extra milk for your baby, or you're not, whichever, but you're tired. You're so tired. So the risk of you injuring yourself is so much greater because of the fatigue. You just, the realization I made coming back after having my children was that it's just not quite the same initially. And I had to be okay with that. It's okay. I just have to do what I need to do now. I will get there eventually, though. Did you find that yourself? Like,
I always thought that because I trained through my whole pregnancy, that when I started up again, and like hands down, when I have a second, I will have a totally different attitude training, because at the start it was, I've got to get back to everything as quick as I can, and I've got to lose some baby weight and all those common thoughts.
yeah.
And I didn't know any better, because my mind was in the mind that I had pre-baby when it come to training, which is I can and I will.
Yeah.
And I wasn't really listening to what I was physically feeling. But my first sessions, honestly, and you heard me talk about this, because I was like, what is wrong with me? My strength turned to nothing. And I thought I was lifting heavier when I was pregnant. I'm not even carrying a human anymore. And where's my strength gone? Like, I worked so hard to maintain it, and it's gone. And you're like, Jade, you just had a baby. Like, just do what you can and your strength will come back. But sometimes you need to be prepared for that, because I think if I had have known I would feel that way, it would have been different. But because I expected to at least have the strength that I had when I was pregnant, like, surely I'd have that postpartum, surely. And I absolutely did not. And also, I don't know why I didn't think this, because common sense is movement patterns change depending on like your pelvis and your gateway. And I remember squatting, lunging, everything lower body felt so clunky and grindy. And where'd my movement pattern go? Yeah. Where do my hips sit now? Why aren't my knees aligning properly? And they were still safe movements. Like, I could squat and lunge, but they felt so different. And as we know, your pelvis changes through pregnancy, and I could squat and lunge my whole pregnancy because I slowly adapted to what my body was doing. And then all of a sudden, shoot forward to baby gone and in my arms, my pelvis and gait is still so different. And yeah, I had no idea how much of a beginner I would feel returning to training after a baby. And not gonna lie, I almost felt insulted by myself. Does that make sense? I was,
you're failing me, body. Like, why are you doing
this? I worked hard, and it wasn't even on it. I expected to look different postpartum. I didn't know what to expect, and I knew I did have a weight loss goal, which and to touch on that too, that's another thing you said to me, is I remember thinking, why is my weight not shifting? Even a year after Casima was born, you're like, Jade, you're still breastfeeding. Like, you don't know what's going to happen, and your body's still doing so much. And I just remember once I stopped breastfeeding, my weight just shifted. I was holding so much fluid, and if anything, my training reduced, because I got to a point where I'm like, I'm busting my chops, and like, it's not working. So just whatever, I'm just going to have fun. And then I stopped breastfeeding, and just the fluid dropped, and my actual scale weight was the same, but the fluid just dropped. And I'll never forget being like, oh, I should have just listened to Belinda. Because everyone tells you when you breastfeed, it helps stabilize your weight and it helps you lose weight because you're burning so many calories. And I'm sorry if this is triggering to some of my listeners, because it's a very weight focused episode, but it's normal to want to lose weight after your baby. And if you don't want to lose weight, that's fantastic as well. Like, be happy and healthy. That's always the outcome.
Yeah.
But I did feel the pressure to get to a particular shape. And I am being brutally honest that I wanted to breastfeed for many, many reasons, but one of them was I thought it would help me regulate my weight. Yeah. And no, it made me ravenous. I was so hungry when I was breastfeeding, and I was never going to not eat. That's one thing I learned through all of my eating disorders and HA recovery is when you're hungry, you eat.
Yeah.
And that was another thing I noticed too. I stopped breastfeeding, my appetite just halved, and by no thought process, it just wasn't there.
It's funny you hear, I would hear all these stories. Midwives would tell me all these stories. The weight would just fall off you when you start breastfeeding. Well, let me tell you, I gained weight when I was breastfeeding, right? I gained so much weight, and I compete in a weight class sport. I have to be a certain weight, and I had every intention of going back and competing after I had Jackson. So I was not prepared. I thought, oh, okay, the weight will fall off me. No, it didn't. Like it really hung on to me until I stopped breastfeeding and until I started getting really good sleep. So, you know, there's one thing that I can say to people, this is what I've learned myself. You know, it's so good to have goals and to set goals, but be kind to yourself. Be kind to yourself, because there are lots of factors that will influence you meeting your goals. Good sleep. Are you breastfeeding or not? You know, are you eating well? I would forget to eat, Jade. I would just be so busy throughout the day, which sounds absolutely stupid because like who forgets to eat? Well, I do. And then I would be so ravenous by dinner time. I would eat everything, everything, and just it was a real eye opener for me.
But that's another thing that I guess when it comes to researching the postpartum journey is like never underestimate having snacks available all the time. Because just what you were saying about you forgot to eat, but it's like if you had something in your bag or on the couch that was a bag of nuts or some fruit just ready to go, it's like, oh crap, I haven't eaten in a little while. At least that's right there.
Or a pre-cooked meal, you know, like something just in the fridge ready to go, because who has time to cook eggs and toast in the morning? And that was my breakfast for a long time, but I found that I couldn't eat that anymore because I didn't have the time to cook, or Jackson was going to be held all the time, so I couldn't hold him and safely cook on the stove.
And that's such a big thing too, isn't it? Sometimes you have babies, because Cosimo is the same. They want to be held all the time. And as linking right back to when we started is like, just love them as much as you can. And if they want to be held, sometimes that means wearing a baby carrier 20 hours of the day. And if that's what gets you through, that's what you've got to do. But just what you're saying on the cooking front, because you eat really well and obviously you've got your staples set for meals, and all of a sudden this beautiful baby comes around, you are sleep deprived, he wants to be held, and all the meals that are your quick and easy go-tos are now longer not available. And then it's like, but who's got the capacity to think of what to eat now?
Yeah, that's right.
It's like I've got so many things to think about now, and food is just not on the list. So for anyone who's pregnant right now or is about to have a baby or is in that, you know, newborn phase, how can you make food easily accessible that's still nutritious and enjoyable? Do you need help? Can someone cook for you? Do you need to pre-order meals online? How can you make that process easier? Because you've got so much on your plate already.
Yeah, I had a beautiful friend. She's got 4 boys who are a little bit older than my children. And I remember her coming around one day and she had, you know, 6 servings of vegetable soup and 6 servings of a butter chicken or something that she'd made. And I nearly cried. Like, oh my God, she's gone to all this effort cooking me really great, wonderful food. Like it was just such a relief, and it was cooked and it was ready to go. I just had to put it in the microwave. It was easy to eat, and I just remember,
and it was yummy.
Oh, and it was delicious, nourishing, and I thought, wow, like if I ever know of anyone that's struggling in the future, this is what I am absolutely going to do. I'm just going to pre-cook something. Too bad if they don't like it. It's food, it's nutritious.
It's so good too, because it is also one of those things where if you know they're home, it's like, and if you're not in a capacity to come out and say hello, that's okay. I'll just leave it at the door.
sure.
Because you never know what that new mum's going through. And as much as they want to see you, they might just not be ready, and that's okay.
Yeah, life might be a disaster. And that's how much anxiety do you have about the house being
Oh my God.
a mess? Like, and people were coming over and I think, oh my God, I haven't mopped, I haven't vacuumed, the house is a disaster, the toilet's dirty, you know, and they're not there to see a house. Your friends are there to see you and your new baby and all the things that you used to stress about. Wow. You know, just, it seems so silly now that I'm out of it, but at the time.
Oh, it's very real. And
yeah.
it's such a big deal. Like it's very easy to catastrophize.
Yeah. Yeah, and it was
Yeah.
It's like a disaster if my house was a mess and someone was coming to visit, or I hadn't baked. Like, I love to bake. It's just one of my hobbies, and I love to do it. I love pleasing people with food, and you know, the thought of not having any baked goods in the pantry, like failure. Like, how can I'm a mum now? Like, I'm a stay-at-home mum. What do I do all day if I don't have baked goods in the pantry? You know.
No, and you create those stories, absolutely. And it's like, no, you're a stay-at-home mum who's busy with her kids all the time. I've just recognized the time, and because I just love talking to you. And I absolutely don't want to cut this chat off, and I feel like there's more episodes in it. But I just wonder if we could maybe do a little summary before you go, and that is introducing exercise postpartum. And I just think you're such a great person to ask about that because, one, you've got the midwifery background side of things, and obviously you've been in surgery and seen it. You've also got the experience of you've had a cesarean yourself, and you've also got an incredible training history, and you're a personal trainer. So you've kind of got all those different elements where you might have noticed too, someone who's trained as a midwife and obstetrician specifically, they can find it a bit tricky to give recommendations and guidelines because that's not their area of expertise. But yeah, we're blessed to have you who's got all levels of experience and knowledge. So could you shine some light on that for us?
Well, and I would like you to jump in too if I miss anything, because you know you're a well-accomplished person training yourself, and you've had children. So I think the most important thing is this more postpartum specific. I guess
you can talk both. You're more than welcome to talk pregnancy and postpartum. I'm sure people get lots of takeaways. So let's do both. Yeah,
well, during your pregnancy, I think it's really important that you are setting goals that are not, you know, breaking personal records. Like when you're training during pregnancy, don't think about, oh, but I used to lift this much weight. It's not about that anymore. It's about just continuing a movement pattern and feeling good at the end of your training session. So as I said, I had a diastasis. My abdominals separated quite a lot. Couldn't do anything overhead. So I would just do some bodybuilding exercises, bicep curls, tricep dips, some seated shoulder raises, you know, anything that I could just do that wouldn't create too much pressure in my abdomen. I really also would recommend focusing on your pelvic floor and your deep core muscles, learning how to turn them on, learning how to not turn them on too much, because if you are turning them on too much, then you're not able to turn on your pelvic floor appropriately, okay? And recognizing how to turn on your pelvic floor, it's not something that someone can really coach you through. You kind of have to just flick it on and be like, oh, that's it. That's what they're talking about. So really working on just keeping your body moving, not overheating, not getting your heart rate up too high, and recognizing when you're not feeling quite right. There were many days where I'd go in to do a squat and I'd be like, hang on, and I'd run to the toilet and vomit, and I'd come back in and I'd be like, you know, probably not a squat day. Maybe I'll just, you know, go do something different. Just do some technique work with the bar or something like that. Because I was quite sick. I think I vomited. The last day I vomited was on like my 24th week.
That's a lot of vomiting.
So, you know, like just gauging it on the day. You're not there to break records. You're there to just move and feel good about yourself and be happy. So postpartum, give yourself the 6 weeks. Like your doctor tells you 6 weeks for a reason, because it takes a minimum of 6 weeks, A, for your wounds to heal with your cesarean section, and B, it really does take that long for all of your fluid shifts and your cardiac system and, all of your muscles and your hormones to just level out and go back to normal. Your body has gone through such big changes. It's not just about a belly and a baby in there. Like it's hormonal changes, cardiac changes, fluid shifts, everything changes. So give your body the 6 weeks. If you want to go for a little walk, and you can go for a walk just around the block, do that. There's no harm in that if you're well enough to do it, if you're able to do it. If you've had an episiotomy, you're not going to feel so great going for a walk a week after, right? So just, I know that you desperately want to get in to the gym and just start training, but give yourself the 6 weeks if it's one thing that I can recommend. Next, start on those deep core activation drills, activating that core muscle, doing the pelvic floor exercises that you did perinatal during your pregnancy, and just come back into, like, you would come back into training from an injury. Just say you've got a shoulder injury, you do some gentle rehab exercises with some bands or some really light weights, just some getting your movement patterns back, some easy warm-up drills, some easy yoga stretches. Getting your movement pattern back is really important, and to rush that will cost you a lot of time. If you try and rush back into it, you'll hurt yourself. You'll hurt yourself badly. And like a rehab program, I would say start really light. Just say you could deadlift 100 kilos while you were pregnant. You're not going to do that postpartum at 6 weeks. Start with an empty bar. Start with some 2, 3, 4, 5 kilo dumbbells. Go slow. It might be so easy, and that's okay. You're not there to bust records on your first week back into training. You're there to get, as Jade said, your movement patterns back. You're meant to get some strength back. I call it a foundation strength. You've got to build a foundation, just like a building. You build a foundation, okay, you build it well, you build it strong, and then you can start layering on top of that, okay? So do just some really light, simple exercises, and please don't jump. You want to get back into double unders, you want to get back into running, you want to get back into, box jumps, whatever. That's really great, but your body won't thank you for it. You'll hurt yourself. You'll hurt yourself. You'll hurt your pelvic floor, you'll have bladder issues. You might even just hurt your hips and your legs and your knees because your body's still going through that adjustment, that hormonal change. Okay, your pelvis isn't going to be the same for a little while. It takes months for your body to level out again, especially if you're breastfeeding. It will take maybe even longer. So I would highly recommend just don't jump. I've got ladies postpartum 8 months and I still don't prescribe any jumping. We do lots of different exercises. You can do really great workouts without going for a run or without going for, double unders and burpees and whatever else. Resistance training is actually one of the best things for you. I'm an old school personal trainer. I've been a personal trainer for a long time, and it was always cardio, cardio, cardio. That's what makes you lose weight. Well, there's a lot of change and shift in that opinion now, where actually as we get older, for women particularly, resistance training is what's actually going to help us lose weight, and making sure that we have, a good balanced diet. That would be really, really beneficial. Very difficult postpartum when you've got a newborn and a family and a household that you're trying to run. But really take the time. It's important you just don't rush back into it. Start slow. It's annoying and it's really frustrating. And look, if you like jumping and if you like running, build up to it. Do interval training first. Just, run for 10 seconds, walk for 10 seconds or 30 seconds. Don't just dive right in, otherwise you will hurt yourself and it'll be even more frustrating. So do you have anything else to elaborate on that? Jade, what do you think?
Yeah, no, that was very detailed. Thank you. I guess when it comes to training while pregnant, a lot of women are concerned they're going to cook the baby because that's a common thing. Don't get overheated, you'll cook the baby. And look, I was one of the women who was a little bit scared to train when I was pregnant because, you've been blessed with this miracle and you don't want to do anything to lose it. And maybe your training will make you miscarry and, all those sorts of thoughts. And especially that first trimester when you do feel really sick, it's kind of impossible to push the limits anyway. Because you just feel so sick. And even if your mind wants to, your body just says no.
Yeah.
And I actually found that throughout the whole pregnancy. And when I did question my midwife about my training, she just said, your body is so intelligent. And as long as you're listening, you know what you have the capacity to do.
Yeah.
Obviously, we're not going to do anything lying on the back or crunches or, you know, certain movements are just not suitable while pregnant. So obviously we're going to implement that. We're not going to do those things. But when it comes to like lifting particular weights, if it feels good and you're not holding your breath and you're not getting dizzy and you're not, I guess actually a really good measure, if you finish a workout and you're exhausted, you've taken it too far. Like, and I guess what you were saying too, we're not trying to break personal records or anything. This is just we're moving for health right now, for mental health and for physical health. Let's just keep moving. But overall, you want to leave your workout feeling as good as what you did when you walked in. If you're feeling tired and you can't be bothered getting your butt there, that's probably a sign you're better off having a nap.
Yeah.
And I know our whole life, it's like, no, go to the gym, make sure you train, do this, do that. But it's actually so different from that when you're pregnant. It's like, no, if your body's signaling rest, go rest. You can train later. You've got your whole life to train. Like it's okay. But you can trust your instinct. And if you want to do, say, some Stairmaster for a little bit or jump on the Airdyne and get your heart rate up a little bit, and again, you're not experiencing any kind of negative feeling, like it is okay to do it. Obviously get medical clearance just to be sure if you have any questions. And if you've never done cardio before, it's not a good time to start. Like we are purely going by you've done a heavy load of training and you've taken it right back and it feels good. Yeah. New stuff can wait till later. Like unless it's Pilates or yoga, like pregnancy safe Pilates and yoga for that matter, it can wait. And then postpartum, like what you said, wait the 6 weeks. And it's so hard because you just want to race into it and get back into the swing of things. And sometimes it's just the mental health side. You just want to feel like yourself again and have your moment. But yeah, be accommodating to all the changes that have happened, and slow integration of movements 100%. Like you said, mobility focused, movement pattern focused. I highly recommend seeing a pelvic floor physio, especially to make sure that you do know how to engage. And they can also give you some guidance on when to add in running and jumping, because they do an internal assessment. If you allow it, they can actually check if you're contracting properly or if you're not. But yeah, offset running and jumping for as long as you can. And that's not because you'll never be able to do it again. You absolutely will. But your body definitely needs time. And I guess the same protocol as when you're pregnant is if you're finishing these workouts postpartum and you're just as exhausted as when you walked into it, it's like, you don't need that right now. Yeah. You know, you need to prioritize rest and sleep. And funnily enough, when you do that, your body will change anyway. It doesn't have to be forceful. But yeah, absolutely prioritizing pelvic floor and core rehabilitation, like over and over again, no matter what your favorite style of training is. It's just so important and so boring, but so necessary.
It is, but if you incorporate it into your warm-up, as I said, like I have a set, you've seen my little set warm-up. I come and train with you and I do the exact same thing every time. Arm circles, leg swings, do my, yoga little poses and my hip release exercises. Incorporate that into your little warm-up and it will make the world of difference. A, you won't skip it, and B, you'll be really prepared for the work ahead of you in your actual workout. So yeah, get it done. It's important.
So important. Now, if anyone wants to reach out and chat with you about training programs or I guess anything we've discussed on here, your Instagram handle or email address, where can people find you?
Oh, yeah. I have 2 Instagram accounts. One, my personal training Instagram account, which is the Garage of Dreams, or it's Garage of Dreams, PT. Make sure you put the PT on the end because there's lots of Garage of Dreams car enthusiasts. That's my Instagram. And yeah, if you have any kind of questions relating to training or to midwifery questions, you're having a hard time with breastfeeding or whatever, please reach out. I'm more than happy to answer your questions as best as I can. If I can't answer your question, I will always tell you I don't know. and I'll try and put you in the right direction. You know, if you need to talk to your midwife or your obstetrician, then I definitely 100% tell you to do that. But yeah, Garage of Dreams PT, please reach out, and I'll do the best I can to help you with your questions or your problems, or you just want to have a chat. I'm always good for a chat on the Jake.
Yes, you're fabulous. You're a wonderful support system throughout the postpartum journey and forever on after that. Thank you so much. So I'll link your Instagram handle in the show notes as well. So if anyone's not sure, they can go have a little look there. But thank you so much for sharing your personal experience, sharing all of your knowledge. And it's been a very informative podcast, and I'm sure so many people will benefit from the content on an emotional level, from a practical level, and even just feeling more empowered about the whole experience. So thank you so much.
Thank you for having me on. I really appreciate it. I had a lot of fun, and I feel really humbled to be asked to come onto your podcast. So thank you again.
No, you're amazing. How could I not? Well, you enjoy the rest of your afternoon, and I'll see you next time.
Thank you.
Bye.